All right, welcome everybody. This is Dr. Dickon Weatherby for another one of our success calls, and I'm joined today by Dr. Cassie Rote. Dr. Rote is a graduate of Parker College in Dallas, Texas. She graduated in 1993 and is board certified Doctor of Chiropractic by the state of Texas. She has never stopped researching ways to get better and faster results with her patients. She integrates bioenergetic and chiropractic techniques with clinical nutrition, diet, and lifestyle correction. And these treatment techniques are governed and coordinated with multiple evaluation techniques using acupressure, reflex analysis, and lab testing. She is the medical director of Rote Wellness, an alternative health clinic offering natural approaches to health. And instead of diagnosing and treating a disease or health condition, Dr. Rote evaluates to find the reason why the body isn't healing, and then uses natural techniques to assist the body to regain its ability to heal. So thank you, Dr. Rote, for joining me today and for agreeing to this interview. For many people that may be listening to this, be it patients or other chiropractic physicians, they may be struck by the combination that you have between the chiropractic techniques and also clinical nutrition, diet, and lifestyle correction, but also by the assessment and diagnostic techniques that you use. I'm just curious, maybe you could tell us a little bit about your practice and how you got involved in functional medicine and functional diagnosis and what that brings to your practice.
Okay, so a little bit about my background and how I got where I am. When I started practice, first I like to go back before I went to chiropractic school. I worked in a chiropractic office in Houston for a chiropractor who was not afraid to take on lots of different things. We would have people come in who would have seizures in our lobby, and he would still adjust them. And so I got exposed early on to lots of different things from a natural perspective and caring for people. And then when I went through chiropractic school, learned lots of different things, not what I thought I was going to be learning, but when I came out and was doing more manipulation and caring for pain, I started to see patterns in people developing, and things just kept recurring and not getting better. And I started wondering why were they getting stuck in patterns? And so I started looking more into how the body was functioning and what was going wrong. And that curiosity led me to functional medicine, and then studying that and studying Dr. Weatherby's books. I put a lab in my office to do urinalysis, and started looking deeper into adrenal fatigue, and that kind of is a kickoff point for a lot of patients. Most people have trouble with stress or sleep, and that's an easy opener for conversation. So as that went on and I got more education in functional medicine, and then with the tools that I've been able to implement that help to streamline being able to see patients and do blood analysis, certainly the software has helped speed things up significantly in analysis and helping patients achieve wellness, and certainly seeing patterns early on. People want to know what you see before things become pathological, and oftentimes, we end up finding things that are pathological and sending those out where they need to go. But other people aren't screening. Even the regular doctors don't have time to screen and look at things as deeply as we want to look when we look at the whole body. So that's kind of how I got to where I am right now.
And what kind of patients do you typically, what are they coming into your clinic, sort of with their chief complaints and presentations?
Well, most of my practice is referral, so usually they don't get a lot of detail as to what we do here, just that I can help. So oftentimes it's stress or sleep, or they may come in with back pain, and then based on what they see on the walls and the materials around, they start asking questions, and certainly without sleep you can't recover. So it kind of starts the conversation, and then we move into the functional medicine aspect of it, gathering their records and blood work, and then ordering labs if they don't have anything current, and that's just kind of how we kick it off.
So primarily they're coming in for visceral work, be it manipulation, back pain, and how easy is it for you to transition into a discussion about other underlying conditions that may be associated with their stress or their weight loss or weight gain or insomnia and that type of thing?
It comes very easily. Certainly when they find out that if they're not sleeping, how that affects their body, and then that they can do something about it, or that you have objective means to measure what's going on with them and then track that. And so they're very interested. People love to hear about what's going on in their own bodies, and they just don't get that information anywhere else. Yeah.
And I think also a lot of people have had blood testing done. It's probably the most popular test on the planet. I think billions of them are done every year. And, at least what I hear and other practitioners have shared with me is that they go to their general practitioner to have their blood work, that appointment, and the doctor pretty much says, oh, everything looks normal, your cholesterol might be a bit high, but everything looks normal, and yet they don't feel normal. And so I think that when someone comes to a practitioner like us, it's a real breath of fresh air because we're actually able to give them some pretty interesting information about what's going on. Do you feel that that's true for your practice in terms of being able to interpret blood tests?
Well, one of my favorites is cholesterol. So if I just had a lady this week who came in and her cholesterol is over 300, and it's a significant jump from, it was 200 a year ago. And she's just now become a new patient here, and we discussed, why her cholesterol, what are the possible reasons why it might be elevating. Not that she needs to run out and get on a statin, but that we're going to do an experiment to see how her body responds to reducing inflammatory foods. So what I often do with patients is we'll do a 10-day trial of removing high inflammatory foods. We usually pick one or two, and then we rerun the blood, and lo and behold, the cholesterol typically will drop 50 to 75 points. And then they're just amazed because typically it's run every year. Nobody ever said you could actually make a change or why it's there, and nobody explains the good benefits of cholesterol and how it affects your hormones and how it affects stress. They just say you got to get it down.
Mm-hmm.
And, so having that dialogue and using tools for each person, it's a little different. But blood is something that they're familiar with, they're comfortable with, but they don't understand it. So helping them make sense of it helps a lot.
And since you've been, using sort of the reporting tool, the software, I'm just curious what the response has been from your patients when you present them with a report like that.
They're very impressed. I mean, they're just, and then the fact that we can keep the history in there, so we can compare year on year, or if there's stuff going on, we may have 3 or 4 reports in a year. But having it all, they know that we've got everything organized, and we're kind of the go-to to keeping up with their stuff. So it's helpful and very powerful to put a report in the patient's hands that's about them, and I think that's important when they leave.
And, obviously, the software's only been out for, 2 or 3 years. I'm just curious what life was like before you had a tool like that. I mean, I remember my days of, templates and spreadsheets and, a lot of time
it took
to...
Yes, it's very time-consuming. It probably took me closer to 2 hours to do the charts, make my notes, things I wanted to look back through their file and rule in or rule out, and this is just so much more efficient. I can have it all done in 20 minutes and feel very comfortable that I haven't forgotten anything, and it reminds me of things that, oh, yeah, don't forget to look at that. Okay, yeah. And so it's invaluable. Just so happy to have the software help me.
Yeah, that's a great benefit. Are there any other benefits that you can think of? Are there any other features that you like?
I like the history, and I like whenever I need a refresher on why I might need to go look at something, I like that I can click on it and it just pops up and makes it easy for me to refresh my memory on a few things.
Well, I have one last question for you. if there was a chiropractic physician who was interested in this work and kind of toying with it and has maybe more of a structural practice and wondering about moving into doing blood work, I was wondering if there's any words of wisdom that you might be able to share from your experience of how one might go about implementing blood chemistry analysis into practice and using a tool like this.
Well, I think having the software makes it so. To me, it's not a question of should you, but why wouldn't you? Because it just helps to elevate the level of care you're able to provide for the patient. And even if you didn't want to get too deep into functional medicine, making suggestions for things that their traditional physician should be looking at for them is valuable, and it just helps to solidify the relationship and keep you as someone who's looking out for them.
Wonderful. Well, I want to thank you very much for taking time out of your busy practice and your busy day to share that with us and sharing your experience. So thank you so much.